I'm taking a question on what do my patients, why do they sometimes have the scars along the sides of their nose, at least when they look on TikTok? Okay, so here's an issue. A lot of my patients want their nose smaller. Now that doesn't sound like a shocker to most of you. Not every ethnicity wants their nose smaller, but a lot of patients, they want their nose smaller. And here's the issue. If you make the nose substantially smaller, and you can measure this on the 3D software we use in our office, you have to have a place for all that skin to go. And if you don't account for this, you're going to have a lot of extra skin that may not be draped over the nose you want to. So just like sometimes an extra, if you get a sweater or suit, you have to take it in a little bit. Same thing with the nose and that extra skin. This is something that can be super helpful in making patients look better and look better sooner. The way this is done is there's a scar that sometimes occurs along the sides of the nose. This little ellipse of skin is removed. Now this little ellipse of skin can sometimes remove 1 centimeter per side, sometimes 1.5, sometimes 2 centimeters. So if you're removing 4 centimeters of skin on a nose, that can be a big deal in your final outcome. Obviously, managing the scar is going to be a big deal. We want to make sure that scar is as inconspicuous as possible. Many of our patients, especially the ones who are local, are going to either have a laser procedure done or sanding of some sort, or they may use something like Skin Uva, which is, again, a great product for our patients to be on, consider using. So is the scar worth it? Well, we really don't get that much feedback on our scars as far as negative feedback, at least long term, but it definitely can be an issue for some. But for most of our patients, definitely worth it. Worth it to see that look, worth it to see those kind of changes you can make, and can be a game changer for patients in general to make those noses extra small.